Hello, everyone. This is the New Mexico Department of Health 2025 statewide training for the VFC program. My name is Zachariah Washington. I am located in the Southeast region, and I'll be doing the statewide training here. I've been with the VFC program now for about a year and a half, and so it's been a great experience, and we're hoping that this training will be beneficial to all of you VFC program sites and all those who are involved with the VFC program. So we'll be going over a couple of things here today. This is the overview of the presentation, starting with data loggers and uploading, TSRs and no temperature data incidents, staff changes, routine and emergency plans, natural disasters, electronic signatures, and shipments. And so these are just kind of the areas that in my region, the Southeast, but also just all areas of the state in every region where a lot of these questions come up. So whether you're a new provider, a new staff member within your clinic, or you've been with the VFC program for a long time, it can be beneficial to watch this presentation and to stay till the end just so you can see what we cover in case there's been any changes or just something you might not understand or something that's confusing. So again, hopefully this is beneficial. So first off, data loggers. So your data loggers are essential for monitoring temperature and vaccine storage. They provide accurate real-time readings for effective vaccine management, and calibration ensures data integrity and reliability. Data logger calibration and settings. These are important regarding calibration because first off, the calibration is due generally every 2 years and ensures that data loggers provide accurate and reliable readings crucial for data integrity. The temperature conversion is important to do. So whenever you first get your data logger, whether it's a new one or you're just getting it back after recalibration, you can convert Celsius to Fahrenheit. That way there's just cross understanding of the temperatures that are being sent, whether it's to your regional coordinators or to people who request it, or within your own clinic, just being able to read those readings in Fahrenheit rather than having to convert Celsius. The VFC program uses Fahrenheit, and so that's why this is crucial. These conversions should be done following page 1 and 4 of the data logger settings control solutions settings. And so that data logger setup instruction can be found on NMSIIS, named Control Solutions VTMC Software Settings, and calibrate data logger in NMSIIS. So throughout the presentation, you will see these red kind of italicized little places that I want you to focus on. And basically I have those in there so that you can find these in NMSIIS yourself. There's a useful way to find things inside a web page. So if you go to NMSIIS under reports, you can type Control F and you can type exactly what these little italicized red bold letters say, these titles of those documents that I'll be mentioning throughout the presentation. Adding your calibration in NMSIIS. Currently calibrated data loggers must be utilized at all times on any publicly funded VFC vaccines. Expired data loggers violates VFC regulations. It's important to note that typically these should be noted at about the 3-month mark. That way you can know when your data logger is expiring within 3 months. That way you can start the process of sending them for recalibration or ordering data loggers, whatever you're needing to do. So that's an important note to make. This is just what that form looks like, the how to enter current data logger calibration information in NMSIIS. So you can follow this guide. I'm putting in here and there throughout this presentation, just a screenshot essentially of the web page or link that I talk about. So this is inside the Manage Assets under Clinic Tools inside of NMSIIS. You can edit a thermometer. You can make sure that it's set to active. that the data purchase is in there, and all of these little red asterisks that you'll see, those are things that need to be filled out. If you don't fill these out, it won't work, it won't go through, or they won't be approved. The calibration date should be entered, and you'll be able to see under Manage Assets where it'll actually tell you when to calibrate by, and it'll say to calibrate every 24 months. And then you need to upload as well your calibration certificate. So there'll be an option there, as you see in the screenshot, that you can choose a file and upload your certificate and your current calibration certificate. And so this is in regards to data loggers. I'm putting in this little, I guess, cheat sheet that you can also find on NMSIIS. It's titled Data Logger New, the 3 modes of the VFC 400. And this is important to note, the ready mode. So this is when it's ready. This is after, let's say, you've docked it and you've uploaded your temperatures, or you're turning it on for the first time after it's been calibrated and the settings have been put in. And this is not the recording mode, so that's important to note. The recording mode will have a check mark. It'll tell you how many days. So this one in the example says 6 days, but when you first turn it on and you see that check mark, it should say recording, the REC in the little dot. It should say 0 days after you've docked it, for example, and make sure that that time is correct, especially after with New Mexico, we still undergo the time changes. And so you want to make sure that it's on the correct time, and then make sure that it's reading in that Fahrenheit. Now, if you see the stopped mode, that is because, of course, the recording has been stopped. It means that there is data in the logger, and you'll see how many days of data. And this is when, I guess, self-explanatory, but there is no data being transmitted. So it is not reading temperatures at this time. So if you come across a data logger that's plugged in to a unit and it is stopped, you want to immediately turn it on, make sure that your temperatures are in range, and then go ahead and dock it and let your regional coordinators know the amount of time that it was stopped and that there was no readings done. And we'll get into that a little bit more later. When it comes to uploading temperature data logger readings, you want to first stop the data logger before initiating the upload process. So again, it should say stopped and show the amount of days as seen on the previous slide. You want to upload the data to NMSIIS promptly after stopping the logger for effective data management. Always upload data before changing a temperature data logger battery. When it's uploaded to NMSIIS, it must be uploaded as a CSV file. If regional coordinators are asking for a data logger report, they must be sent as a PDF file. And you can actually, inside of NMSIIS, if you're looking at just the steps and the little presentation on how to do your data logger setup, you can actually select, and I'm trying to remember what slide it is, but you can actually select where it will allow you to select the CSV and a PDF file to be saved. And so when the regional coordinators are asking for a data logger report, they must be sent as a PDF file. Ensure data logger is recording. So after you've uploaded the data, you replugged in your temperature data logger to your unit, you want to check after 15 minutes to make sure that it still has that little check mark, still says recording, and is showing a temperature. And on the uploading days, you don't want to wait until the end of the day to upload. You can upload at the beginning of the day, so the due date for uploads according to the calendars. That way, if there are any issues, you can fix it throughout the day, because it's tough whenever you're at the end of the day and you upload your data logger and you find out, oh man, the temperature went out of range, or there was a time where it wasn't recording and I had no idea. And now you're going to have to wait till the next day. And whereas if you just did it in the morning, you kind of have the whole day to figure that out, get it fixed promptly. You can follow the upload, or you need to follow the upload calendars on NMSIIS under reports named 2025 calendar January through June and 2025 calendar July through December. this is what the calendars look like. And so you can see here that it has a little color-coded key at the top there and just tells you what each area means, of course. So the temp logs due by end of business day. And again, on those purple, dark purple days on each month, those are indicating that those are the days you need to upload. And like I said, you can upload at the beginning of the day to make sure that you can take care of any issues that might have arisen throughout the month. And then, of course, the bi-yearly recertification is due this year in this month of April. And so that's what that light pink will show there throughout the month. And so you have until the end of the month to get that done. That's kind of the final deadline is April 30th. Now, we'll next talk about the TSRs, the out of range protocols. And I have another little reminder here before walking away. Make sure your VFC 400 screen looks like this. So whenever you have a TSR, you first want to put a do not use sign on your affected unit. Do not remove the data logger until the temperature is back in range. Ensure that the data logger is back in range before docking the data logger. The reason for this is because if you do see a temperature, let's say you walk in and your VFC data logger is beeping and it says 50 degrees Fahrenheit, and you immediately remove it after stopping it and you dock it and you send it to your regional coordinators and it shows that the last reading was 50 degrees, your coordinator is going to tell you to redock it and wait till it goes back in range. That way you can ensure that your unit is going to be stable and return back to a stable range. So just try to prevent more work for yourself. Let it go back into range first. You can still notify the regional coordinator, but let it go back into range and don't dock it and download the data until it's gone back in range, showing a stable temperature again. So like it says here, once in range, carefully move the data logger and dock it for data transfer. Download the collected data from the data logger and upload as a CSV file to NMSIIS and send the temperature readings via email as a PDF file to regional coordinators. Report any and all out of range incidents to regional coordinators. Once you've contacted your coordinator, you will be guided regarding a TSR. Approval of use of vaccines. So this is an important note to make. Usually the manufacturers will let you know that the vaccine is still stable. It still appears to be still viable, but vaccines are not approved for use until done so by the regional coordinator in your region. And the reason for this is we keep track of previous possible TSRs. So if there's been other times that that same vaccine that was affected by this excursion has been in previous excursions, we have to look at the cumulative hours of excursion time. So if there's been previous excursions, that time can kind of build up all together. And if the manufacturer doesn't have note of that or doesn't know about it, then the regional coordinators do, and we do know about it. And it's also important to write down date and time of a previous excursion on a vaccine. So if it's gone out of range, just note that on your current boxes that are in the unit. That way, if an excursion happens again, you'll know if there's been a previous TSR. That way you can let the manufacturer know and also just let your coordinators know. So there is a difference between a TSR and a no temperature data form. So what occurs a lot is that being proactive, which I think a lot of us as healthcare professionals do, we want to get ahead of things because there's so many things going on already within the clinic, within the hospital, and wherever you're at. So a lot of times if there's like a no temperature data incident, many times people will, right away go to NMSIIS, download the VFC troubleshooting record form and fill it out and say when the temperatures weren't being recorded and everything like that. But this is unfortunately incorrect because many times the wrong form is sent. So it is important before doing a TSR which is the out of range temperature incident, or before doing a no temperature data incident and assessment form, you should first contact the regional coordinator so that you can be directed on whether a TSR is needed or a no temperature data form is needed. Now, the no temperature data forms cannot be found on NMSIIS. It is sent by the regional coordinators. The VFC troubleshooting record form can be found on NMSIIS, and that's for the out of range occurrences that happen. So of course, the VFC no temperature data incident and assessment form is used when there's a gap of temperature data for any period of time. The VFC troubleshooting record form is to be used when there is an out of range temperature range incident. This includes any length of time and temperature data. And all supporting data from manufacturers before vaccines can be reviewed for approval must be sent. And each form must be electronically completed. Handwritten forms will not be accepted. This is the two front pages of each of those forms. So it just shows you the difference there. So as you read through each what to do steps, you'll see that on the no temperature data incident form, it does not say all steps are required. It tells you where to stop before contacting a regional coordinator. Because once the form is sent, then you can start to fill it out, and then you want to stop and make sure whether you need to contact the manufacturers or not. And then the out of range temperature incident, all of those steps are required. And so you can kind of see the difference here. And then once again, the no temperature data form is only sent by the regional coordinator and cannot be found on NMSIIS. This is the second page, and you can see here that I've circled event details, and this applies to both of the forms on the left and right. But those event details are very, very important. If the description is not provided in detail as it says there, including the cause, like what happened, whether a door was left open, there was power outages, anything like that, it needs to be put in detail what occurred. That way there can be an opportunity for education in the future. If this is not filled out though completely as it indicates there, the form may not be accepted right away. It may have to be edited. It may be sent back to you, to the provider. So moving on to staff changes. Staff changes must complete the required chili and you call the shots trainings. New staff members must be sent to NMSIIS for approval, or in NMSIIS for approval, and upload the training certificates to NMSIIS. Now, these trainings, again, are the chili and you call the shots. They can take up to 3 to 5 business days to be approved. Typically, it's a little bit sooner, but allow that time before kind of wondering, hey, what's going on? Why am I not being approved? Make sure that you have done your trainings, and then once you add the new staff member information, you've uploaded those trainings with the staff member. That way, the approval process can be quick and not be sent back to you or you having to do additional steps. Whenever there's any staff change, there should be an updating of the routine and emergency vaccine management plan with those changes. There are specific instructions that can be found on NMSIIS titled VFC Provider Staff Change of Contact and Training Documents of August 22, and that's under reports. Now that form, I have the slides here that just show exactly what to do here. So if, let's say, for example, you're needing to update your primary coordinator, the Z4, and you need to put in a new staff member in that place. What you first need to do is remove the current listed Z4 as it shows here. It'll go to a status of pending, so it won't be approved right away. And once again, allow 3 to 5 business days for approval. Then you want to add a new staff contact, add, for example, a new Z4. And you want to make sure you fill out all of those red asterisks and maybe even just fill out everything that you can in there as well. That way there's accurate information. So once you've added all of that and you've hit create, you want to add your trainings that you've already done, because if you try to add a staff member and those trainings have not been done and they're not uploaded, it will be denied, and you'll have to talk to the program and and they'll tell you, hey, add those trainings. So make sure that you do that first. Whenever you click add training, as it says here, the add training box will pop up. The course name, you can click that to drop it down, and you can select call your shots or the Chile training, and then you can put the date in that it was completed and save it. So that is detailed here as well. And once you've saved it, it'll say who uploaded it and what type of form it is, and it'll also have the link. And then after, like I said, you've done the update, it'll go to a status of pending once again. And so that is how you should add that new staff member. And then it goes on regarding the backup and the steps to do that as well, because every site is required to have a primary and a backup. Now moving on to the routine and emergency plans. Annual updating of R&E plans is required. You'll often see us reference these plans as R&E plans, so just take note of that if we're emailing you. These are required every year, and also anytime there are staff changes, data logger changes, refrigeration unit changes, pretty much any change that changes something on that R&E form needs to be updated. And those R&E plans will have to be done with new signatures with the new information. You can find these forms listed here as the new emergency vaccine management plan and new routine vaccine management plan under reports in NMSIIS. So the routine vaccine management plan, this is a little breakdown of it here. So the template completed will fulfill VFC program requirements. It should be reviewed and updated annually or after changes. Assigned staff must sign the signature page each review. So by that, it means any primary and any secondaries that are listed on NMSIIS must sign this, and the provider as well. The plan will be evaluated by VFC program site reviewers. So you send your R&E plans to your regional coordinators for approval. Keep the plan on the vaccine storage units or near them for easy access, but we often recommend to keep them in a little, pamphlet. That way you always know where they're at. And if they're attached to your primary fridge, for example, or primary freezer, you always know where your routine plan is because it has important phone numbers and contact information for you there. So right here, you can see the routine vaccine management plan, first 2 pages. And you want to make sure that all of this is filled out. So even if there's if you have additional Z5s, so you don't just have one primary or a backup coordinator, then you want to make sure that all of your backups are listed. So if they're listed on NMSIIS as backups, they need to be listed on your plans. And then you want to make sure you fill out that vaccine storage unit portion. And then if your area has, or your facility has a maintenance or repair company, and then you also want to make sure you fill out the data logger area completely. Now, this little area at the bottom left, the form certification, you want to make sure that this is completed. Many times this is missed, and it's just not filled out. And so you want to make sure that whoever is filling out the form puts their name, title, and signature. So please make sure to do that. That way you're not having to get your R&E plan sent back to you. On each plan, the routine and the emergency plan, you'll see these little boxes here. This is for very key information and responsibilities of the primary and backups within the clinic. It is essential to make sure that you pay attention to these, and you checking them off is for you to say, yes, I've read this, but it's also saying that you understand what is being shared here and that you know where to go back to look at the vaccine management personnel responsibilities and key duties. You'll see more of those checkboxes here as you go through. It gives you very important information regarding vaccine storage units, temperature monitoring, stock rotation, returns and transfers. And so that's all there for your information. It's all required that you follow that, and you checking it off means that you understand and that you have read through it. And then the signature log. So this is where, once again, all of your staff need to sign if they are a primary or a backup coordinator with the VFC program, as well as your physician signing agreement. Want to make sure that those are signed. Now, once again, these signatures are required to be electronic, and an electronic signature is approved if it has the time, date, and an electronic signature associated. And at the bottom here, the training log, you want to make sure that all of your trainings and everything is up to date. And whenever you do a new training, the R&E plans will have to be updated with those trainings. Now onto the emergency vaccine management plan. So this also completely filled out will meet the program requirements. The program requires that each practice develop and maintain a emergency vaccine management plan. And the plans must be updated annually or after any changes, just like the routine plan. Outline actions for emergencies affecting vaccine viability. This is what the emergency plan does. So examples would be unit malfunction, mechanical failure, power outage, natural disaster, or human error. You want to keep the plan on the vaccine storage unit for easy access. And we also recommend that a copy be placed with the emergency pack out. So your emergency pack out is those, coolers that you can put your vaccine in if there is an emergency. If you're needing to transfer them to another site or another clinic, hospital, and you can have that emergency plan in there, a copy of it. That way you can follow it. So very similar to the routine vaccine management plan, you want to make sure that you fill out all of the data here, fill it out completely. And you also want to make sure that you put in that VFC 400 DDL technical support information there. And the also want to fill out the vaccine storage unit information. And I believe that the VFC 400 DDL, going back to this, but the VFC 400 DDL technical support in the red circle, I believe that's on the back of the data loggers. And so, or you can look it up online. That way you can ensure that you have their technical support number on your emergency plan. That way you can quickly contact them if there's any issues with your data logger. And here you can see that it asks if your clinic has a generator. This is important because you want to make sure that you select yes or no. And if you do select yes, please follow that prompt that says, if so, where is it located? That way, whenever you do have a site visit with your regional coordinator, they can kind of check on where it's at and make sure that it follows regulation. Now, on the plan A, B, and C that you see here, it kind of describes it at the top there, but these plans A, B, and C are other VFC sites that you are listing as places that you can transfer your vaccines in the event of an emergency. Now, it's important to note here that you should never transfer frozen vaccines. Never, ever transfer frozen vaccines. But your other vaccines, if you're going to transfer them to another site, you can list your first site that you would plan to transfer as Plan A. If they are not available, you will have a Plan B site to transfer them to. If Plan B is not available, then you'll have a Plan C. And then if none of these are available to transfer to, then that is why Plan D is there, which says close and seal all vaccine storage units, use large do not open signs, record the date and time the units were closed, and make sure all data loggers are on and recording. So this Plan D is there because if there is a if there's any danger or weather emergency or something of that kind, or if none of these other sites are open or available to you, then you need to follow Plan D because you don't need to be risking your safety or going out on a weekend when all of the clinics and your clinic is closed. That is not at all what you need to do. If it's not during operation hours, then you don't need to worry about transferring vaccines if there's a severe weather or anything like that. So please make sure that you take note of that. Plan A, B, and C are there for you to know where you can transfer, but Plan D should be followed if those options are not available or safe for you to do. All clinics must have emergency packouts, and so you want to make sure that you put in the location of those emergency packing supplies. That way they can also be reviewed by the site reviewers, your regional coordinators, but also so that your other staff, whenever they utilize the emergency vaccine management plan, they can know exactly where those emergency packing supplies are. And then once again, we're back to that form certification. And so you want to make sure that you um, do the form certification and fill that out. And then once again, just like the routine plan, um, there are these check boxes that you need to follow, and it's very useful for you to go through with not just as a primary, but with your backups as well. And here's some more here, just talking about packing and transporting vaccines. And then you want to make sure that the signature log is completely filled out and that you have those electronic signatures as well. So a little bit more on the natural disaster preparedness. Follow your emergency plan during natural disasters. No approval is needed for emergency transfers. If unable to transfer, for example, it's not safe, leaving vaccines where they are is acceptable, which is that Plan D. Do not go to transfer vaccines if there's any risk to you or staff. Do not transfer if your office is closed due to expected disasters or unexpected disasters. So, kind of like I said earlier, just reiterating that. Never transfer frozen vaccines. So there's another reminder. If expecting you may need to transfer vaccines, it is a good idea to print out your count sheet. So in the Southeast region, that's some good advice from Kelly Bassett, one of the other coordinators. She always advises to print it out. That way, if you are transferring your vaccines, you can know how many vaccines there are when you were transferring and just know how many you're leaving at a site. Now, I've been mentioning a lot about the importance of electronic signatures. So electronic signatures, many times, at times, people may not know how to do them or haven't had to do them in the past or had to do this type of electronic signature with a date and time and your name listed. So it's important to know that these electronic signatures are in compliance with the VFC program documentation. Pretty much every form, I think at this point, for the VFC program has to be electronically signed after it's been completed if there is a signature box. A time set validates the authenticity of electronic signatures. Organizations can use Adobe Acrobat to create free electronic signatures. You can access a little educational form on NMSIIS called Creating a Digital Signature in Adobe Acrobat. Now, I've also put together a little bit of a just step-by-step of creating an electronic signature that I've found useful, and it's all using Adobe and it's completely free. So once you've downloaded Adobe Acrobat Reader, you can you'll get this page if you have Windows. It'll be like this on your screen, and you'll want to click See All Tools. You'll see there at the left of the page it says Fill and Sign, but this will not get you that electronic signature. So you want to click on See All Tools. It'll bring you to this page where there is an additional option, which it doesn't show in the beginning for some reason on that cover page, but you can click on Use a Certificate and click Open. It'll then prompt you to select a file that you're trying to digitally sign. So you want to make sure that you first download whatever form has been sent to you that needs to be electronically signed, or if you have an R&E plan that you're filling out, that way you can add your signatures there. You then want to click on Digitally Sign, and if this is your first time using Adobe Acrobat, it'll actually have you fill out a digital signature, kind of like a key to where you put in your name, your organization, title, things like that, and it'll create a digital signature. And then if there is like a little box that you have to click on to sign in the future on some forms, it'll automatically within Adobe ask you, do you want to use this digital signature? And you can click on your name that'll be listed, and then it'll input it, and it'll look just like this, where it shows John Smith and has the date and the time. So hopefully that's helpful and useful for you guys. Now this is in regards to shipments next. So you want to make sure that you review the NMSIIS shipping calendar for timelines. In case of major delays when you're waiting for a shipment, check for a VFC program email or look on NMSIIS for any notices of delays on the homepage. Especially over this winter, there were a lot of delays, so that is a good reminder in case it is during the winter season and things like that. There will be delays like that. Now, ensure your office hours are current in NMSIS and also notify your regional coordinators of office closures. So those office closures, whether it's for like a holiday or if there's some weather event that's going on and you guys are leaving early for the day, please just send an email to notify your regional coordinator or give them a call to let them know, hey, we're closing early. That way, if there are any shipments on the way or en route, we can try to figure out while you guys go home during the, whenever there's a weather event, you guys don't need to be worrying about where your shipment is or anything like that. The regional coordinators can kind of deal with that if your clinic is experiencing an emergency where the office needs to be closed. So the ship day ends at 10 a.m. So if an order was entered after 10 a.m., it'll be entered into the Vtrix the next business day. So this is important to note here because what this is basically saying is that if you were expecting a delivery to be done on Monday, for example, and you're like, okay, this is when it should come in, but you sent it after the ship day and you sent it, for example, at 11 a.m. on a Wednesday rather than before 10 a.m. on a Wednesday, you'll get that shipment on Tuesday instead of your anticipated Monday timeline. So hopefully that kind of makes sense, but you can kind of read through that again if you're needing to. Always check the receive by date and time on the shipping label when your vaccines arrive at your clinic. If it is past that date of receive by, you need to contact the regional coordinators. That way we can make sure that the vaccine is viable. We may have you reach out to the manufacturers to let them know as well at some point down after you've contacted us and we're able to figure out with the VFC orders team. And so don't just automatically try to send them back or contact the manufacturers without letting the VFC program know. The first thing you should do is let the coordinators know. So there's a little helpful vaccine shipping days form here on the right, and it just gives you that example of when you're putting them in the days that you submit to Vtrix. So you have to make sure it's before 10 a.m. on, for example, a Monday if you're wanting it to get to you on Thursday. If you submit it after 10 a.m., it will probably get there, for example, on that next, Monday or whenever time according to your clinic hours. All right. So next here is just a helpful, I guess, reminder and kind of a, I guess you could call it a chain of command, but mostly just on like how to communicate if you're needing something urgent. So if you are trying to contact your regional coordinators, contacting the regional coordinator is always the first line of contact before contacting the help desk. Email communication. So if the coordinator is unavailable by phone, then and it's like an urgent matter, you can use email for effective communication as well. Now, if one of the coordinators is not answering, let's say, and you have another coordinator in your region, then you can try to contact that other coordinator listed on your routine plan. And then if no coordinators are available and you're needing something pretty urgent or needing something that day and the coordinators are out of office, for example, or doing visits or something like that, then you can contact the help desk. And the help desk number can be found on NMSIS on that first page whenever you log in NMSIS. This is all of the VFC program contact information, and I do believe that this is all up to date. Now, you can find this form on NMSIS, and anytime there's been an update, whether there's a new immunization coordinator added or just staff changes in general, whether it's um, just anywhere within the VFC program, this form will be updated in NMSIS. And I believe that it's named the VFC program staff in NMSIS as well. So be checking that periodically to make sure you have all the current contact information. So you can see all of the um, points of contact uh, in Metro, Northwest, Northeast, Southeast, and Southwest. So this is important to um, have and pay attention to so that you know who to contact. Um, and so thank you everyone for attending and watching this training. And hopefully it's useful and helpful to you. And please remember, if you have any questions or anything like that, you can contact your coordinators or the NMSIS help desk, and we'd be happy to help you. And please keep up the great work. Thank you.